We'd like to welcome everyone to session 262. And we're going to talk today about endocrine disruptors. I'm Becky Johnson. I'm from Portland, Oregon, and I'm a 15-year papillary thyroid cancer survivor. And also have been dealing with hypoparathyroidism as well. So I'm anxious to hear what the doctor has to say. We would like to welcome Dr. Aarti Mathur, and she's an associate professor of surgery and oncology at the Johns Hopkins University School of Medicine in Baltimore. She serves as associate vice chair for faculty development in the Department of Surgery, is the fellowship director for the Endocrine Surgery Fellowship, and directs the CORE's Endocrine Surgery Research Group. Dr. Mathur earned her medical degree at the University of Texas Medical Branch in Galveston, and she completed a general surgery residency at Georgetown University Hospital, during which she spent several years at National Cancer Institute. She then completed a fellowship in endocrine surgery at Johns Hopkins and has a very busy clinical practice that focuses on thyroid, parathyroid, and adrenal diseases, and has a focused practice designation for adult complex thyroid and parathyroid surgery, something that's close to my heart. One of her research interests is environmental risk factors for thyroid cancer. And with that, we would like to welcome the doctor.
Thank you so much for that kind introduction and for the opportunity to be here today and talk to you about endocrine disruptors and thyroid cancer. And it's something our group, I'm very passionate about. And I hope I can share some of what I have learned with you. So I want to just briefly talk a little bit about the risk factors for thyroid cancer, look at some endocrine/thyroid disruptors and their link with thyroid cancer. And then the third thing is really, well, okay, that's great, but what do we do about it and how do we avoid it? So we'll just start with a typical person that I see in a clinic. We have a 36-year-old. She happened to walk into an ER, got a CT scan, showed a thyroid nodule, which then prompted an ultrasound. And there's her nodule, and she gets it biopsied, and there's papillary thyroid cancer. So as I'm seeing her and talking to her in clinic, I'm thinking, okay, well, yes, thyroid cancer, there's lots of different types, and we generally refer to our papillary and follicular varieties as our kind of well-differentiated thyroid cancer. So throughout the talk, you may see DTC, and this is what I'm referring to. But the most common question, one of the most common questions I get is, why do I have thyroid cancer? And it really gets me thinking, and I don't know, right? And that's the honest answer is we don't know. Yes, there are certain things we do know, but I don't know, and that bothers me. So we do know that there are risk factors for thyroid cancer, and we think of non-modifiable and modifiable. And when I think of non-modifiable, there's that blanket umbrella term of genetics. And we don't always fully understand genetics, but we do know that there are some hereditary syndromes that make us prone to getting thyroid cancer. So those are things like if you've ever heard of familial adenomatous polyposis or Cowden's disease. And then, we also know that having a first-degree family member with thyroid cancer increases our risk of thyroid cancer, although we haven't quite worked out the molecular basis. So we can't choose our family. They're there. Our gender, males tend to have a little bit more aggressive disease. It's more common in females. And then age is another kind of prognostic risk factor that we think about. We know that if you're young, you have an excellent prognosis most of the time. But then there are these modifiable risk factors. And some of the modifiable risk factors that we have learned about are things like iodine deficiency in our diet. Being iodine deficient in the United States is really hard to do. We just can't do it. This is relevant to areas outside of the United States. Obesity is one. So obesity has been associated with both follicular thyroid cancers and papillary thyroid cancers. And then the most well-studied environmental risk factor is radiation exposure. And I just want to use radiation as an exposure as an example, just to talk about how we came about it, what we've learned, and now how to go forward with other things. So we incorporate these risk factors into choosing surgical management. So we used to have a kind of one size fits all. Everybody gets a total thyroidectomy with or without a central neck dissection. And our pendulum has really shifted to where we want to provide personalized care that's also oncologically safe. So we take into account tumor size and all of these risk factors so that if your tumor is less than 1 centimeter, we can even watch it. And if you're less than 4 centimeters, you don't actually have to have your whole thyroid out. So let's take a look at how we came up with the radiation exposure. So we learned about ionizing radiation through 3 large nuclear disasters. That's how we first came about this. So in 1945, we had atomic bombs that dropped on Hiroshima and Nagasaki. That was diffuse, instantaneous irradiation. The whole body got irradiated, massive doses. Then came Chernobyl, and this was predominantly iodine that was released in an iodine deficient area where there wasn't much shielding. And then by the time that Fukushima happened, we had learned a little bit about food shielding, how to protect people. And so we knew a little bit better. What did we learn from these events? So we learned that these were mostly papillary thyroid cancers, but they were a little bit more aggressive. And so if you look at this figure here, it's really just showing the incidence of thyroid cancer based on the year of exposure. And what I want you to take away from this is that, we started seeing an increased incidence about 4 to 5 years after the initial exposure, but it really skyrockets 10 years later. So there seems to be this lag phase of the exposure and when you get thyroid cancer. And then this figure really looks at the number of operated on thyroid cancers by the age that you were at the time of the exposure. And what I want you to take away from this is that the younger you were, the higher the rates of thyroid cancer were. So we learned that the thyroid gland was most sensitive to radiation in the first 2 decades of life. The past couple decades has taught us a lot about molecular profiling of thyroid cancer. We've learned about somatic mutations and drivers of tumor growth and progression. We have learned that BRAF is the most common mutation that's been identified in addition to the RAS mutations. And we also have now learned that radiation has a distinct molecular signature and actually doesn't carry those most common mutations. We know that up to 90% of radiation-induced thyroid cancers have a RET rearrangement. So it took us 50 years to learn all of these things. We learned that the thyroid gland is most susceptible to radiation when you're young. We learned that the increased risk of exposure or the increased risk of thyroid cancer, you can get it up to 60 years later. These cancers tend to have more aggressive features, and they're distinct in their molecular signature. And so now it's incorporated into all these guidelines of when we think about, is this person eligible for just having half of their thyroid removed? So here are 3 different guidelines: the American Thyroid Association, the British Thyroid Association, and the National Cancer Center guidelines. You cannot have had prior radiation to consider a hemithyroidectomy. We would prefer to do a total thyroidectomy. And I think we all know that thyroid cancer incidence has been on the rise for several decades. It's officially, I believe, started to plateau and maybe slightly decrease over the past couple of years, but this is a pretty dramatic rise. And when you look at this increased incidence, the light green is the incidence and the dark green is mortality or death from thyroid cancer. And when you look at these graphs, it looks like mortality hasn't really changed and the incidence has gone up. So that made everybody say, well, we're just picking these tumors up fast, right? Everybody's getting imaging. We're just finding them. This is just increased detection. But if you zoom in on this graph, because the y-axis is so wide, what you'll actually see is that the mortality is actually increasing by 0.6% per year. So might not just be increased detection. If you look at this graph, what this is showing you is the increased incidence by staging of disease. So if it's just localized, confined to the thyroid, which is the orange, blue regional disease, and the black triangles are distant disease. All three of those are increasing. And on the far right, you're looking at tumor size and the incidence of those particular sizes of tumors. So we are seeing not just an increase of small disease and localized disease, which is what you would expect if you think it's all from just over detection. So I think that there is something a little bit more going on than just increased detection if we're picking up increased incidence in regional, distant, and larger tumors. So then you could make the argument, well, obesity's also been on the rise, and you said that obesity is a risk factor. So this is a study that looked at, okay, well, how much does the rise in obesity account for this increased incidence of thyroid cancer? So it accounts for about 14% of all thyroid cancer and about a little over half of thyroid cancers over the size of 4 centimeters. So we can't just blame just detection, can't blame just obesity, there's something else. When we look around the United States, the rate of new thyroid cancers also varies. So the increase in incidence is different depending on the state. It's also different depending on where you live in the world. South Korea is a little bit of an outlier. They have a highest incidence, but they also have a screening program for thyroid cancer. But if you look below them and across the world, there's a 15-fold difference in this increased incidence. So that's led a lot of people to look at endocrine disrupting chemicals and what is the role of these chemicals in causing cancer. So what are endocrine disrupting chemicals? Well, they're chemicals that mimic, block, or interfere with hormones in the body's endocrine system. They can disrupt reproductive, they can disrupt metabolic and thyroid function. They impact a variety of symptoms, and they're present nearly at everyone at low doses, and they can accumulate over time. There are about 1,000 endocrine disrupting chemicals that have been identified. So there are common sources of these chemicals: plastics, personal care products, things that we give to our children, pesticides, clothing, and antibacterials. So we can find endocrine disrupting chemicals in all of these things, and these are products that we use daily. But I think what's important to know is that these chemicals interact throughout our lifetime with other risk factors, including genetic susceptibility, and at really time-sensitive windows. And so the time-sensitive windows that we tend to think of are fetuses, children, older adults, pregnant women, right? So those are very time-sensitive windows. So as part of the American Thyroid Association, we've been working on a statement of environmental factors impacting the thyroid, and my group specifically is looking at thyroid cancer. So the first thing we did is we went to PubMed, which is the repository for a lot of scientific work. And if you type in a lot of search terms, you'll find about 750 articles, which we narrowed down to 445. We excluded things that weren't original studies, and we narrowed it down to 172 articles, of which then showed us about 36 different chemicals or forms of a particular chemical. And so I just want to talk about kind of the disruptors we found, because we want to focus on thyroid disrupting chemicals. So there are about 9 studies looking at pesticides. So we know that pesticides can alter thyroid hormone production. And thyroid hormone production has sometimes been associated with thyroid cancer risk. And there are lots of human studies looking at pesticides and risk of thyroid cancer, time windows of exposure. And many of these studies were done in California, looking at agriculture workers who are exposed to extremely high doses of pesticides. And so when you compare it to somebody who's getting a normal exposure to pesticides, it's hard to parse out, and the studies are inconclusive. It's also difficult to parse out exactly which chemical in the pesticides is causing it. There are 9 good ones that looked at it, and they're not actually consistent in the type of pesticide or the component of the pesticide. But there seems to be something there. Flame retardants. So there's a variety of chemicals that have been identified as flame retardants, and sometimes you'll see them as PBDEs or phthalates or anything in fireworks. So we also know that flame retardants alter thyroid homeostasis. And the studies are a little bit mixed when you look at thyroid hormone, but also they're mixed when you look at the associations of thyroid cancer and flame retardants. BPA, so who here is drinking out of a plastic water bottle, right? We do it all the time. I am to blame myself sometimes. So BPA is a plasticizer. We find it in many different places. Our plastic cookware and Tupperware also have it. And it's interesting, there's been an inconsistent association with thyroid cancer, a more consistent association with thyroid hormone imbalance. And then there was one study that said, well, what if we just look at obese patients and look at that? And they seem to find an association. But the bottom line is inconsistent results, with some studies finding some studies not finding some. And then these 3, I want to talk a little bit about more in detail. They've also quite been in the news. So PFAS. PFAS is a chemical, heavy metals, and then air pollution. So about 16 studies looking at PFAS, heavy metals, about 24 studies, and air pollution, there were about 17 studies. PFAS is called the forever chemical. I don't know if anyone here has watched the movie Boss Baby. I have kids, so we watch it sometimes. They try to make a forever puppy. That's a puppy forever to replace the babies. Well, PFAS is kind of that forever chemical. It just doesn't go away. It's really hard to degrade. And here's all the things that it's found in. It's also found in pesticides. It's found in paint, those microwave popcorn bags. It's found on furniture, any containers you get for takeout food. It's found in a lot of our cosmetics and a lot in the nonstick cookware. There was a pretty well done systematic review where they combined all the studies looking at an association with thyroid cancer, and they didn't quite see one. So what we're looking for is that bottom, does this have a pointer? So the bottom line where, we want it to be on either side of the line, and it's smack dab on the middle of the vertical line. So there was not really an association with thyroid cancer, but if you look at the individual studies, there are some that do show that association with thyroid cancer. That being said, we do know that it alters thyroid hormone function. And so there's been a pretty strong legislative push to limit how much PFAS is in our drinking water, because it is found in our drinking water. And so this is a pretty recent map from this year looking at levels of PFAS in our drinking water. There are bans coming down the pipe looking at that. And also there are always lawyers waiting to help and assist. Somebody sent me this ad the other day and I was like, oh my gosh, I didn't realize you could sue for your drinking water, but you can. And then heavy metals. So the push to really look at heavy metals actually came in the 1980s when all these islands in Iceland, the volcanic areas of Hawaii and Iceland, they started reporting really high incidences of thyroid cancer, much higher than what we were seeing in the rest of the world. And the thought was really that, the lava and ash is polluting the soil, that's contaminating the vegetation. The animals are eating that vegetation, and whatever the people in that area are eating is biocontaminated. So there's actually a study looking at people who had thyroid surgery, and what they did is during the surgery, they took out a sample of fat right next to in your neck, part of the muscle that you have to go through anyways, and then the thyroid that was removed. And they measured different levels of metals in each of those tissues for every patient. Now, we don't know for certain if all of these patients had cancer. They all had surgery for an indeterminate nodule, but the study itself doesn't disclose how many had cancer and if those concentrations of muscle or metals were different along those. Arsenic and cadmium have already been identified as carcinogens, but you can actually see there's a whole list of metals that are elevated in the thyroid compared to the adjacent tissue. So whether it's being concentrated in the thyroid, whether it is associated with that, hard to know. There are several other studies looking specifically at manganese and cobalt, but the big ones that kept consistently coming up, lead, arsenic, nickel, and mercury, were all pretty consistently associated with thyroid cancer. And the interesting thing was that there seemed to be an inverse relationship with zinc. So hard to make any firm conclusions, but this is kind of what we're seeing. And then if, you don't just get exposed to heavy metals just from being in a volcanic area. If you look at the ingredients of any of the cosmetics and makeup or products that you're using, there are oftentimes metals in those products. Drinking water can often be contaminated with metals. And then there are some foods that are, depending on where they come from. And then you can also inhale that dispersed kind of aerosol. So when I look at this picture, what I see is that kind of smoke, and that's what they were talking about, the inhaled things that brings over. And I think, to me, that looks like air pollution, right? And I think we all kind of have a frame of reference of what we consider to be air pollution. And most people, at least for me, this is kind of my frame of reference. But there's actually a definition that was put forth by the World Health Organization. And so air pollution is contamination of the environment by any chemical, physical, or biologic agent that modifies the natural characteristics of the atmosphere. And so it comes in a variety of sources. And when we think of pollution, there are outdoor pollutants and then there are indoor pollutants. So outdoor pollutants, these are kind of how we get around: planes, cars, trucks, bikes, or buses and motorcycles, our power plants, industry, vegetation, livestock, fertilizer. And then there are things that we just can't control, like Mother Nature, right? Volcanoes, and there have been a lot of wildfires. So I often, what is air pollution? It's a little confusing. What does that even mean? And actually, there's a composition of air pollution. So air pollution is made of gases, but it's also made of particles. And when we think of gases, the gases that compose air pollution, we have ground level ozone, nitrogen dioxide, sulfur dioxide, carbon monoxide, and then volatile organic compounds. And a lot of these things come from all the burning of coal, petrol, diesel. We get a lot of volatile organic compounds from industrial glue and dry cleaning facilities. And then there are particles, and we call this particulate matter. And particulate matter is a mix of solids and liquids that's just too small to kind of settle out under the influence of gravity onto the Earth's surface. So these things kind of float around. They're super tiny, so you need an electron microscope to see them, and they're classified by their aerodynamic size. So coarse is anything around 10 microns. Fine PM is less than 2.5 microns, and ultrafine is less than 0.1 microns. Now, of all these components, ground level ozone and what we call fine PM or PM 2.5 are thought to be the most kind of noxious components of air pollution. And the main reason for that is because they have the longest atmospheric lifetime, so that they can float and live in the air for a really long time. And this is just to put it into size perspective. So PM10 on the far right, this is big enough where your airways will trap it. So this kind of stays in your lungs. But if you look at PM 2.5, it can actually get absorbed into your bloodstream and then go and exert whatever effects that it wants. It's still bigger than the COVID virus, but it is tiny enough to go into your bloodstream and go out to whatever organs. And so the cardiologists actually were much smarter and ahead of our time, and they released a scientific statement about PM 2.5 and how it actually causes heart disease. So there are guidelines. We all know air pollution can cause lung cancer. There are actually guidelines by the WHO and our EPA to limit the amounts of exposure that we're getting. And the EPA actually has monitors installed all throughout the United States. And they have about 1,900 PM 2.5 monitors around the United States. So you can imagine there may be some gaps in where they're able to pick things up. So we know that lung cancer can, air pollution is a risk factor for lung cancer. We know air pollution is bad. It causes a lot of different effects. So what does it have to do with thyroid cancer? And why am I sitting here talking about it? And I think we actually learned a lot from this horrible, tragic event that happened September 11th, 2001. And I'm sure many of you remember that day very well and exactly what you were doing when you heard this awful news. From an environmental perspective, if you just take a step back and look at what happened, you had about 10 or 90,000 liters of jet fuel, 10,000, massively high temperatures that then collided, and then you had collapse of towers, which provided a complete environmental acute disaster. And so the environmental folks in New York actually thought this would be a good thing to study as it happened. So the day after the event, there were PM 2.5 monitors installed, and every hour they measured PM 2.5 until the last fire was extinguished, which wasn't actually until May of the following year. And they also measured hourly carbon. And in case you're wondering, there was not an increased amount of radiation here. And you probably remember that there were about 60,000 people that came out that day to work, ground zero, carrying out rescue recovery, restoring essential operations, and just helping out and cleaning up massive debris. So those 60,000 people are offered annual medical surveillance, which includes imaging. And so after 14 years of following them, they noticed an increased incidence of thyroid cancer up to 14 years after this event. And they categorized by, did it matter what day that you showed up? And it turns out it did not matter what day you show up. The risk was increased regardless. There were about 14 or 15,000 firefighters that came out and worked. And what they found is that the firefighters also had an increased risk of thyroid cancer. And what's interesting to note is that this risk was increased early on in the first several years. And then 4 to 5 years later, it's still increased. So this is different than what we saw with ionizing radiation, where it took, this whole 10 to 20 year lag time for us to see anything. Here we're starting to see them early. So we chose to look at our own patients with thyroid cancer. So we had about close to 2,000 patients. We found close to 4,000 controls that had no thyroid disease whatsoever. And the cool part of what we did is we got to work with our School of Public Health, which is across the street, and there's a pretty large environmental department there. And they had come up with this model system, which was developed, they validated it, and basically what it allows you to do is it incorporates satellite data, it incorporates EPA data, meteorologic data, and aerosol optical depth, so that you can actually calculate a 3 by 3 kilometer radius of PM 2.5 concentration. So we took all of those patients and calculated the amount of PM 2.5 they were exposed to 12 months, 24 months, and 36 months prior to their diagnosis of thyroid cancer. So here's kind of the geographic distribution of our thyroid cancer cases, just so you get a sense of the areas that we're discussing. And what we found was that after 2 and 3 years of exposure, you had at 2 years of increased exposure an 18% risk, and at 3 years, a 23% increased risk of being diagnosed with thyroid cancer. And I want to just make it clear that I'm not saying that it causes, because we can't say that yet, but we know that you're more likely to be diagnosed. And then if you look at the graph on the right, what that's looking at is concentration levels of PM 2.5 and diagnosis. And I also just want to be very clear that these are all acceptable legal limits. So they're within our limits that the EPA sets forth. And this is what we are seeing. So I started to kind of look around and got curious as to was this what we saw? Were other people seeing this? And actually, around the world, people were showing the same thing. And then this has been happening, I guess, for the past 5 or 6 years. So we then did a systematic review where we went again back to that PubMed search engine, found a bunch of studies, screened, and ultimately what we were looking for is studies that looked at some component of air pollution, so the components that I showed you, and an outcome of thyroid cancer, and we're able to quantify both the amount of pollutant exposed and thyroid cancer. So we narrowed it down to about we looked at nodules and cancer, so 2 studies with nodules, and about the rest 9 studies were with cancer. And this is a really, really busy slide. But the point of this is these are the 9 studies that looked at thyroid cancer. So you can see that they were done at different time points, different countries, different study designs, fairly large sample sizes. And the way that they measured pollution was different. And despite that, with particulate matter, with ozone, the 3 studies that looked at ozone all showed a positive association. So there was some consistency there. And then similarly, PM 2.5, there were 4 studies, all consistently showing an association. So it is really difficult to do this kind of research and work and to understand how much is this contributing to my risk. And if we think about the reasons, some of the common things I get asked are, well, did you account, for how many times the person moved? Not yet. It's also difficult to say this causes this, right? And how do we incorporate all the other pollutants and all the other exposures? They have just started generating silicone bands to quantify exposures to all of these things. And how do we account for the mix of the endocrine disrupting chemicals? And then finally, the genetic susceptibility is a pretty big piece of this, right? So we all hear of those like 100-year-old people who are alive and they have a drink every single day, or they smoke every single day, right? So there's something about our genes that makes us more susceptible to some exposures versus others. And we're still trying to learn all of these things. But we know we have some kind of suggestion of some association with these thyroid disruptive chemicals that are present everywhere, They're present within all of us at nearly, at low concentrations and varying concentrations. So what do we do about this, and how can we reduce our exposure now that we know this? So there is actually guidance from the Endocrine Society of how to reduce your exposure to these endocrine disruptive chemicals. So one, you want to thoroughly wash all your fruits and vegetables before consumption. This is going to get rid of all those pesticides. I used to think buying organic foods was a price hike and a gimmick and didn't know what that meant. But it means that your products are not exposed to some of those pesticides. And it means that your meats are not given different hormones to make them larger. So I do now buy organic produce, meat, and dairy. You want to avoid or limit your amount of canned and processed foods that you eat. That BPA is on every single can. There's lots of chemicals to kind of keep your food fresh. Iodine's essential for thyroid hormone production. I don't think anybody here would have that problem. And if you're a vegetarian, there's some suggestion of soy phytoestrogen excess might increase your risk. You want to try to avoid nonstick cook pans, so ceramic pans are great. If you're going to use plastic containers, please don't put them in the microwave. That's how all the chemicals kind of leach out into your food that you're going to eat. And ideally, you don't have to use those plastic containers. You can get, glass, porcelain, or ceramic containers. I don't think we do have this anymore, but thermal paper receipts, I feel like everything's now Apple Pay, and I'm not sure that's a big thing to worry about. But just arming yourself with the knowledge of knowing what is in the skincare products that you use and what does that mean for you. And there's actually a website you can go to or an app. It's this EWG. It's a website, it's an app. You can type in your product and it will tell you the harmful components and what they've, kind of been associated with. You can check the air quality and avoid outdoors when your pollution levels are high. So I'm not sure if you knew this, but if you go to your weather app on your phone and you scroll down past the weather, you can, right below it, it says air quality. You can click on that air quality and it will tell you the primary pollutant, and it will also go through the levels of each pollutant and whether they are at limits or above limits. And then there's also a website called airnow.gov. You can consider an air purifier just to limit the indoor air pollutants depending on where you live. I have one in my office at work. It's a building that was built a very long time ago. You should also know what's in your water. This is less regulated. It's much harder to regulate because a lot of our pipes were built a long time ago. So same website, EWG, and you go to tap water, and there are different types of water filters. So it depends on what the primary levels of metals and pollutants are in your area. There are different filters that are recommended. So I was curious, I typed in my zip code, and this is what popped up. So we actually do have a reverse osmosis filter for our water. They sell them for your refrigerators as well. So if you have a refrigerator that, gives you water, you can just certainly get a filter to put onto there. There are plenty of resources if you need more information. There's the Endocrine Society website, the American Thyroid Association website, and then the EWG, which I just shared with you earlier about all the things that are there. And just to sum it up, the landscape of thyroid cancer epidemiology and management has really evolved over the past several decades, so we now incorporate risk factors. And there seems to be an increasing evidence of an association between several modifiable environmental risk factors, including air pollution and thyroid cancer. But we really need more studies to better understand exactly how this is happening. Is it happening? What exactly can we do? And then how do we incorporate these findings into either managing thyroid cancer, or actually more at a health policy level of, do we need to have tighter control, or is there a better way to limit what is produced? Because we still love all of the things that the industrial power plants make, but is there a way to limit it? And just to kind of contextualize it, we're just starting to scratch the surface of this aspect. And with radiation, it took us 50 years to understand it. And even now, we're still learning. And so we have just started to learn about this. I suspect over the next 50 years, we'll learn a lot more about some of these chemicals that are harming us. And that is all I have. So thank you very much for your attention. I'm happy to answer any questions. I wanted to make this more of a dialogue, and I am happy to give out my email address. If anyone has more questions or research ideas or wants to help participate, I am incredibly grateful.
I have a question for you.
Sure.
So, with all of our modern devices that kids are using now, I mean, cell phones, computers, all of those things, what about radiation exposure from any of the everyday things that they're using?
Yeah, that's a great point. So the computers and iPads don't emit radiation, they emit a different type, but yes, it's a great point, and it's another area. Yeah, hard to know, but yes, I mean, we all now have cell phones, and absolutely, it is hard to know, but something worth studying.
Hi. So if there is a strong link to all those pesticides to thyroid cancer, why are they banned?
So, if there has to be some degree of pesticide use to maintain the produce, right? And so they're not banned, because then we would, there's a strong push to say, well, it's going to hurt our agriculture business. And so it's the agriculture and the lobbyists associated with that. There's a lot of pushback.
Maybe there won't be any, any more people to eat that product.
The study on the air pollution, you showed the map of where people were located, and it seemed like northeast. I mean, that's where you are, but did you look at was there a difference in the chance of thyroid cancer by region?
So we looked by 3 by 3 kilometer radius for the person. We didn't look by northeast, south. I certainly can do that.
And did you measure you just use standard levels of reported air pollution?
So there's a deep learning neural networks model that our environmental department created, and it incorporates reported levels from the EPA, reported levels from satellite measurements with our NASA's equipment. And then they also measure our aerosol optical depth. So it kind of overcomes this spatial resolution issue that we get with one individual monitoring. So it essentially combines lots of different monitoring stations in lots of different areas and ways to capture that radius.
Okay. And do you recommend testing your water at home or just using the filters?
I would use the filters. If you go to the EWG website and you type in your zip code, it'll tell you where your water supply is from. So for the county that I live in, it supplies most of that entire region's water, is the Washington State, it's a WSSC. And so they will tell you, they have already measured it for you. You can certainly do it yourself and see if you get the same results. It would be interesting to know, but a filter is kind of your best bet. I think the question is which type of filter works best for the water supply that you are receiving.
Thank you.
Sure.
Great talk. Did the ATA make any statements or updates regarding EDCs and thyroid function and/or endocrine disease?
That's what we're working on right now. The problem is we're restricted to a page limit, and I think that's what we are struggling with right now. And so we will probably likely come out with several different publications. So my group is the thyroid cancer group. So we did that. And so I did share that with you. But yes, coming soon.
This is pretty helpful. So one question in terms of like, it seems like the mid-Atlantic states have a lot of like a higher incidence rate. There's like a visual where you had the map and it was like a heat map. What factors led to that? And are you seeing that people who live like within a certain proximity to, say, a power plant, a steel mill, a any industrial kind of facility is at a significant higher risk? Like if someone lives within 5, 10, 15, 20 miles, does that impact anything?
Yes, yes, absolutely. So we see thyroid, but we're also seeing other cancers. There are certain regions that are known as cancer alleys. That's their nickname. And one of them is in close proximity to a bunch of landfills. There's another cancer alley around where DuPont had, they made a movie about this as well, Aaron Brockovich maybe. But lots of different kinds of cancers, not just thyroid, but yes.
Awesome.
So the radiation you were mentioning here, it's only the ionizing radiation?
Ionizing radiation.
Oh, okay.
Yeah, so we use it less now. Now we use it to treat mostly in childhood cancers. But 50 plus years ago, it was used to treat acne. It was used to treat tonsillitis. It was used for a variety of different reasons. And so, yeah.
Hi, thank you so much for this information. I'm wondering for radiation exposure for things like dental x-rays, for example, what's like a good protocol for doing that? Because obviously that's basically right on your thyroid or right near it. Do you have a suggestion for, I know there's like the thyroid guard. Is that enough? Does that actually make it worse?
Yeah, so if you're going to get an x-ray, you should always shield your thyroid, and they have those. That being said, the amount of radiation that we're talking about is pretty heavy. That's been linked to thyroid cancer. And so I typically get worried when somebody tells me that they were, a baby, they were born premature and in the ICU for like 6 months. Because then I know that poor little baby was getting daily x-rays for 6 months plus more than maybe some just once a day. But an annual dental x-ray typically does not give the doses of radiation that we saw be associated with thyroid cancer. And then I would just say, I always remind people sometimes that, when you fly on a plane, there's also radiation that's being emitted that you are being exposed to, but it's a low dose, right? So we take risks in everything we do. It's just really about kind of reducing our exposure.
Thank you. And then one other question, you mentioned genetic susceptibility. Like, are there certain things that are known in terms of that? And like, is that something, I guess, how do we find out if we have any?
Yeah, that's my next project I would love to do. Yeah, so we don't know. And it's one of those things where we won't know until we measure from people who have thyroid cancer and people who have no thyroid disease and send off genetic testing to see, what looks different. And so, yes, we're trying to figure out the best way to do this without impacting somebody's like ability to get insurance or do anything.
Thank you.
Sure.
All right. Is there any research linking EDCs to thyroid function or dysfunction? And is there any form of like modern pharmacology or pharmacotherapy that can have a positive impact on any of this?
Oh, that's a great question. So, yes, so there is a lot of data looking at, so all of those thyroid disruptive chemicals that I showed have also shown changes with thyroid function. So pesticides especially, thyroid function, BPA, thyroid function. So absolutely, hypo and hyper. And so then I don't know if we know yet of anything that would mitigate that function or something we can use to counteract it.
My question, because he's my witness, I have been making him crazy because I feel fully validated listening to all this stuff now because I've been going, I've been obsessive about like replacing all the plastic containers and
Yeah.
the makeup that I wear and everything. So is there a place we can go where there is a list of acceptable things,
Yeah.
products, and where would we find that? Because that would be very helpful.
So the EPA has a list of all the chemicals, like the thousands of chemicals, but the EPA maintains like a huge repository. I've tried to go through that list. It's hard. But that's certainly one place you can go to. And then EWG. So that's a great place to kind of explore that website. I can get lost there sometimes because I'll go down a rabbit hole. But they go through personal care products. They go through all the cosmetics, shampoos, conditioners, body lotions. Yes, everything.
It can make you crazy trying to, I mean, even going to Costco and looking for, we got rid of all the cookware that had any of the non-stick stuff. And it, after a while, you're reading labels and you're trying to research it. And it's an important thing to do. So knowing what things are safe to buy would be
Yes.
very helpful.
Yeah.
Yeah.
So not to get specific medical advice, but my wife is not here, but 17 years ago, she went through a series of radiation treatments for breast cancer. And then last year she was diagnosed with thyroid cancer. Could that have any connection?
Yes. Yeah. And I think, did they maybe, I don't know, sometimes you have to incorporate the neck for breast cancer because the lymph nodes of the neck can be affected by breast cancer. And so she certainly was exposed. And the issue is the time course seems accurate. But we also know the thyroid's most susceptible in the first couple decades, but that doesn't mean that that couldn't have been affected from the radiation in this case. But we don't, I don't want to make a, firm like, yes, this caused it. But yes, I mean, I'm sure it played a role.
Couple questions. One is how can we, I guess, get involved in this research, like just based off of our medical histories, our cancer diagnoses, or cancer treatment? Like, is there anything we can opt into? That's the first question. And then the second one, since it's in the news and not to like go down the rabbit hole here, some places, including where I live in Florida, have banned fluoride. And apparently there are some concerns that's an endocrine disruptor. Do you think that's a net positive? I stopped using fluoridated toothpaste personally, so I've been to the dentist since, but
Yeah.
we'll see.
I probably need to look a little bit more into fluoride before I answer that question. I have not seen those studies. Yes. Yes. So I think maybe a little bit more work on the fluoride question. If you would like to get involved, let me ask Gary what the correct way is. I'm happy. You're welcome to email me. We have several studies ongoing. Yes, I would welcome any ideas or participation. But really, I think what we're trying to do is get complete environmental and exposure histories of everything people were exposed to, which then means where did you live when you were this old? Where did you live here? Where did you live here? Where did you work? What did you eat?
I grew up 2 miles from a DuPont plant, and I've lived in like 6 different places from Delaware to.
Right. And so just calculating all of your exposures, that's what I really ultimately want to do also. Yeah.
Hi, thank you so much for this talk. You've got my brain just going right
Oh,
now.
no.
But I wanted to go back to the comment about premature babies and x-rays.
Yeah.
I was a preemie baby. I was in NICU for 6 to 8 weeks. So I was just curious. I was unaware whether or not I had excessive x-rays or x-rays while I was an infant. Can you expand on that a little bit more?
Yeah. So there are babies who, you know, depending on how premature, whether you're able to breathe on your own or not, or whether you require support. If you require support to breathe, you do get a daily x-ray to make sure that the support is correctly placed. And because NICU babies are so tiny, they just x-ray the whole body. Yeah. And so you're really susceptible to the radiation at that age. And so we don't know, you know, how many x-rays is too many for an infant or a premature baby, but you're definitely getting that radiation.
It's, you know, most thyroid cancer patients are getting tests all the time and possibly for the rest of our lives. Is there any way that you would say we should limit, you know, types of tests or how often we get them? Is there one test that's more dangerous than the other?
I think when you're getting tested for treatment, then you're kind of accepting the risk of, okay, this is a very low dose, one-time need for radiation. Or in your, you know, we do CT scans. I do them frequently for some of our cancer patients. And I think we don't know how much is too much. You do get a small dose of radiation, which should theoretically be okay. But at some point, I think if you're an infant or you're, you know, your thyroid gland's susceptible to that, I think that amount of radiation is still okay to
So
get.
it's something like every 6 months or
Yes, I think then you're doing it because you actually have to do it, right? That we often get worried, like, okay, if we do it, we're putting ourselves at risk. If we don't do it, we're still putting ourselves at risk. Which camp do we want to be in? And I'd say the same argument goes for radioactive iodine, right? When we think there are a lot of studies looking at secondary malignancies in people who get radioactive iodine. And we, you know, it's one of those things of, do I want to take the radioactive iodine because I want to treat my thyroid cancer versus think about, is there a potential for another malignancy if I get the radioactive iodine or not?
Okay. I've been learning a lot about how obesity is a, contributing factor. So do EDCs promote lipogenesis? And if so, does that help promote the formation of free radicals that help cause cancer?
We don't know that yet. That's one of the mechanisms, right? So we don't know if EDCs cause lipogenesis. But we do know obesity is associated with it, yes.
You were talking about X-ray exposures. I'm a registered nurse, and when I started many years ago in the 80s, late 70s, I believe we had chest X-rays as part of our pre-employment to rule out tuberculosis, even though they tested, with the little skin test. But I'm pretty sure we had multiple X-rays, even if we were not high risk. So if we were in school at one hospital, in the summer working in another, I could have had a bunch of X-rays between, say, ages 20, 22. And I think that's routine. I don't know if you look at that type. There's lots of healthcare workers. And, we don't do that anymore to people because we know better. They only X-ray really high risk. But I think I had quite a few based on jobs I had or training, as
Yeah.
well as the first few jobs.
Yeah. So I think that we do know that high doses, prolonged exposure in the thyroid are associated with thyroid cancer. It's hard to know if, that number of x-rays that's equivalent to that dose, right? And I think, if you get an annual x-ray every year, you still don't equate to the doses that we see associate. There are a few studies looking at extremely high consumption of phytoestrogens have been associated with thyroid hormone dysfunction. I think the soy and the estrogen there's some association, not a very clear one. And if people who are vegetarian tend to have a higher consumption of that. So
I have a question about the iodine deficiency that you're
Yeah.
mentioning. So I know, I think you said it's not as common, right, in the United States, but if someone has had like a blood test or a urine test, I know that those can measure iodine levels. If we do show to be deficient in iodine, is there something that you recommend, like just dietary intake of iodine of like a certain amount that we make sure that we're getting,
Mm.
or?
So I'm not sure if iodine deficiency gets captured well in a blood or urine test because iodine concentrates in different organs in your body, mainly your thyroid. So you could still have a low level in your blood, but have sufficient levels in your thyroid. And there's the kind of distinction there. The reason I said it's really hard is because it's added to most of our foods, including salt. So if you eat anything with salt, you're getting plenty of iodine unless you use a special kind of salt. Yes, best to use Ida salt, but if you eat fish, great source of iodine. Potato chips, like if you eat any bag of chips, though, that's iodized salt. Yeah. Thank you all very much, and thank you for your questions.